All right. Well, you have probably already seen him in the trailer of the movie Sources Within You from Dr. Joe Dispenza. He is a practicing neurologist for over 20 years and is here to deep dive with us in his healing journey with multiple myeloma cancer. Dr. Charlie or Charles Oliviera, thank you so much for agreeing to this interview.
My pleasure. I'm so delighted and honored and I'm blessed to be able to share my story and share with you our experience.
Yes, and we already did it in Spanish, so we've gotten to know each other a little bit, but I'm so happy that you've agreed to do this in English now, and add a little bit more, and hear it in a different language. So thank you so much. So I have a lot of questions from members of the different groups of Dr. Joe Dispenza on Facebook, and I run a few groups myself on Dr. Joe's work and also on alternative healing. So, but I would really, most of the questions I believe are going to be answered as you share your experience in this casual conversation. I think it's a beautiful thing when people just, love to hear stories, and your story is really going to impact so many people when this movie finally comes out. But so I would love to start by asking, from a doctor's perspective, you are a neurologist, and from your perspective, for those people who are dealing with a diagnosis right now, how important is the doctor's view on healing when giving a diagnosis, and has this changed for you since your personal experience in healing?
It is an important key in the management and the healing process or journey for everyone who have a disease, either cancer or multiple sclerosis or some other heart condition, any incapacitating condition. It is important the treating physician attitude toward that patient. I'm a physician. I can tell you that, I'm sorry, but not all physicians, not that I'm special and I know it more than anyone else, but I have seen many patients who have encountered a physician who doesn't give any hope, simply give a number. A brain tumor, you have 50% chance of being alive 5 years from now. Something like that. Because I'm a neurologist, I see patients with multiple sclerosis. I have seen many people who come worried to see me, and they say, oh, Dr. So-and-so saw me and said, I'm going to end up in a wheelchair. And they take it like from granted, like that's an absolutely true, statement. And unfortunately, doctors don't realize the power of their words.
Right.
So essentially, independently, if someone is a good or bad doctor, the quality they offer, one essence in the care of people is to give hope. Hope is the last thing that you take away from people, even though they can have malignant brain tumor, can have advanced multiple sclerosis, they can have advanced dementia, many conditions. You don't take their hope away because in their hope there's a road to get better. As we were mentioning in the interview in Spanish, when they give you a diagnosis of, in my case, that I had cancer. So they give you the diagnosis of cancer, multiple myeloma. You look into the literature, so people don't live much, maybe 3, 4, 5, real 10 year, 15 year. But there's a factor that makes a difference. So, but many people say, in a very simple way, physician who have treated me, well, you have maybe 2, 3 years more until they get advanced, or 5 years. And listening to other, medical conference, about 10 years. So you figure out, well, these people are experts. They don't read the same book. They don't know the same, because everyone is totally different. And obviously there are different stages of the condition,
Right.
Cancer, but they focus only upon one road, not compromising. They offer the least hopeful avenue in a way they do it because I don't want to give false hope to people. But it's up to the person to use that hope to their benefit. But you don't decide for someone you're going to have cancer, you're going to die in 5 years.
Wow.
You don't do that. You know, even if that were your clinical experience, it doesn't apply to everyone. So we have to be very careful. And once, you know, it's difficult. Once they tell that to the patient or to the family, they close doors. There's a road, there's a road that give me 5 years of survival, but that's not the only road. There's other, you look a little bit to one side, there's a different road that you can take, different path.
Right.
But not the predetermined road that the physician or science or the literature tell you that it's going to be. It's not like that. From physician standpoint, you know, apart from what happened to me, I've seen people with multiple sclerosis walking like nothing for 20 years. And then they're different. There are people who advance and then you work with them. But, you know, don't assume, don't take it for the worst. So you have to faith, open up, receive, and then you will get farther. No question about that.
Do you think this is the old model of the medical training? Is it, how do you see this changing now? I mean, now that, are you seeing more doctors being open to this, and now with this moving all this, the research that is showing, do you think that things will be different?
Well, in the past, the doctor were very dogmatic, very respectable. Whatever they say was the law. So it have changed. I have seen people who are elderly, now elderly. Elderly is relative term, 60. So when I was 20, 60 was elderly. But that's it. So, you know, but I have seen people that they open up, they see experience had brought them light into being more humane, being more spiritual, and seeing other realms of healing different from the usual medical realm of pharmaceutical, or what they call allopathic medicine, which means just trying to heal, not to heal, try to cure people with just medication. Healing goes beyond. You can have it, but it's under control, but you feel healed, you're positive, you're light, and you're able to reach, you know, further distances and expand that love, that knowledge, that help towards the people who are surrounding you, giving a good example. New physicians now, they tend to be, you know, when I was a younger physician, maybe I was kind of bold in the sense, you know, bold and ignorant, even though I knew a lot. But that's a bad combination, because you go along, you know, in a very simple way. I may have said to someone, you have a stroke, so, you know, the chances of survival are bad. I no longer do that. If something catastrophic, obviously you need to be realistic, but again, you don't take the hope away, because there are people who look very bad at the intensive care unit on the ventilator, and everyone prepare the patient and the family that are going to die. Say, well, the chance of, you know, not doing well is 95%, but they say 5% of people do well, but you don't know what that 5%. So if the patient is young, yeah, you need to do whatever you need to do. If the person is 90 years old, 90, then yeah, they can do better. But the same, you have to be realistic. You have to be blessed that you were able to live that life, and then celebrate. But in the, you know, that they had a good life, fulfilled life. But in a young patient, no question. You do whatever, even the outcome is bad. No, you just do, because you never know. And I have seen people. The good thing about working in a hospital, that you see miracles every day.
Oh wow!
And then published, you know, that you're there, make a movie or do something. You see people that are supposed to die because of the catastrophic stroke that they had, or they have like 99% occlusion of one artery and have, you know, and they have a minor stroke. You say, well, there's something going on that is helping you beyond the medical field. Medical field, I'm going to help you, but there's something else and that's something else. Include the prayers,
Okay.
faith, the prayer from the people,
Okay.
and then after my healing experience is acceptance, being able to accept the help that comes from up above from the source that help you heal, not only heal you, but everyone else. And it could be depression, it could be anxiety. There are many other things that are not specific,
Right.
medical, physical ailment, but there's something that's spiritually drain you and doesn't allow you to feel happy, the happiness that you're entitled or deserve.
Yeah, those are beautiful. Do you mind if we repeat those elements that you just mentioned? Very key elements that are, the so important to also include, like the prayer, you said faith, care from people around.
Yeah, the thing when I personally, what I tell people, and it's standard, is that when I was diagnosed with cancer, it could be someone like a fisherman being diagnosed with cancer. We have the same deer on the headlight vision, like space out. Maybe in my case lasted like 2 days specifically.
When
But thing, I know what it means to have cancer. It's not when you diagnose someone else, you're caring, but when it's yourself, you're myself. It was myself diagnosing myself of having cancer. So with that, I learned that the important thing is to, you're not alone. You need God, the source, or whatever you want to call it. But the important thing is to have faith. Second is to have the prayers of everyone that love you, that want you to get better, the positive vibration. And I put third, the medical aspect, chemotherapy, medication. Keep in mind that even though I was diagnosed with the cancer 5.5 years, almost 6 years, and I had the healing experience with the coherent healing in June of 2023,
we'll get into
I required chemotherapy before. I required radiation. I required the bone marrow transplant at that time because I didn't know about Joe Dispenza, about meditation. I had a lot of faith, and that has its place. It's not substituting the, the medical care with faith. Of course, you're faithful, but sometimes you go along with both. And if you give a medication or receive a medication with faith, it's more powerful. We were talking before then that, if you are receiving a medication that helps you a certain percentage, maybe 60%, it will be another bad percentage of yielding help. And you have faith, you add the placebo effect on top of that. So it's synergistic. It just have so much momentum.
Wow.
The medication and the faith that you have, and that allows you to go surpass, break the sound of illness, and then fly freely, giving an example and extending those vibration or frequencies to everyone. But that's important, faith, the prayer, and the medical realm cannot be abandoned. It has to continue as well to a certain degree, and then monitor how much. In my case, once the result came back that I was negative, both by blood test and by bone marrow, the oncologist said, no, I wouldn't receive, give you chemotherapy, cause more harm.
Oh, wow.
This no evidence of the disease. So in that sense, it was not empiric, like allopathic. We're going to continue giving you the chemotherapy. Right. And actually, the patient for the chemotherapy for multiple myeloma at that time was continue giving it until the patient, progress. So what? Telling something just with this fulfilling prophecy that I'm going to continue to get ill.
Oh, wow.
You're not giving it with the intention of healing.
Right.
Yeah. And that's interesting because that's the word that the package insert says about that type of chemotherapy given for multiple myeloma.
And what you were mentioning about that it's a team, like you become a team with the doctor, like it is both that work together, like the medicine that is given in a certain way, but then to receive it with that placebo, with that faith, with the, you know, to add to the power of it. But then it is something that is just not, you know, one way or the other way, you know. So it is something that you work with the whatever you are.
It is a teamwork. It's like having a team of like basketball players. You have, you know, the whoever direct them, you know, the coach. And then I think if the coach doesn't have faith in that team, I don't think they're going to do that well. Maybe they're so good that they can surpass the negativity or the lack of faith of that coach. But if the coach is encouraging, you know, going to do well, very good. If they make a mistake, don't worry, that experience, we're going to go ahead with this.
Yeah.
So you don't sabotage people. So, and then I get that some physicians or doctor, let's put a doctor, because a physician for me is someone that they try to heal. But a doctor is someone, you know, has a title of do medicine. But if they don't have that faith, the encouragement, then they're not helpful, unfortunately.
Yeah.
And that decision to, you know, change doctor to someone who will be able to understand how the patient feel. It's normal feeling like that. Like me, I always been empathic towards patient with cancer. But once I had, and I did neuro-oncology, you know, I did part of my specialty was giving chemotherapy to patient with brain cancer or complication of cancer systemically. So, but essentially having cancer myself, I understand better. I have a credential that some of the doctor doesn't have because that person have not experienced that.
Right.
It's like a friend of mine, not a doctor, he's an engineer, very, very smart lady. She said, I don't go to a male OBGYN, you know. That's her, I'm not saying that I'm saying this, but that's her argument. Said, you know, why do you say that? No, men OBGYN. And she said, because men does not know how painful is the menstrual cramps. Woman OBGYN will understand me better.
Totally.
And totally true. So if you have experienced something, then you are in a better position, you know, credibility and understanding, empathy as someone who has not experienced anything.
Yeah, to relate. And I really love what you said before, you know, to be okay with asking for a second opinion and to seek out the person that the doctor, the physician that you feel good about, you know, that will give you a different perspective and that will empower you and that will respect you as a you know, as somebody that has the ability to be the team member, you know, to do the work, you know, and not just be doomed or like by a diagnosis that's, you know, that
right
is like a prophecy, like you said, just to find you know, the medical team that will be supportive and that you align with in that way.
Yeah, it's very unfortunate. Many, I'm not talking about all doctors, not all doctors are like that, or physicians. But they, you know, if the patient doesn't die, they get mad. So, you know, he proved me wrong. Patient is supposed to, you were not supposed to. And they say to the doctor, you know, how come you told me that I have only 1 year to live? I'm just 15 years afterward, I'm just still alive. If the doctor's still alive. So, and then they get perplexed. We have to be humble enough to be thinking, well, you know, I didn't follow what I learned. There's something else going on here.
Right.
Let's explore. And that was the wisdom. So everything happens for a reason. That's one of my mottos. So I understand that for many things. When I was diagnosed with the cancer, you know, with the chemotherapy, you know, with the Joe Dispenzas, with the coherent healing that I mentioned in the documentary, when I went to the 7-day retreat, I was not expecting to be cured. My intention was to to learn how to meditate because my wife told me, let's go to this place.
Yeah. Well, can you tell us about your journey now? I think we're ready to listen to all that journey, because people don't know, how was it for you from.
Yeah. So I became familiar with Joe Dispenza by the pandemic. There was, we have to be in our house. So there's a channel called Gaia that has many wise people talking. So 80% of that is very good. 20% I put debatable, but 80% is really, really solidly good to me. And that includes Joe Dispenza. And I have heard, what he said, about vibration, frequency, positive thinking, another realm of healing. Not that in much detail as the seminar of the retreat itself, that was more intense. But then, my wife said, she's a psychologist, she knew Joe Dispenza even before. And she said, there's an opening. So there will be opening this day. We have to be in the computer. And she was here, I think she was here in Puerto Rico, and I was in Arizona, in Yuma, Arizona.
Yeah.
So we time we just clicked, immediately to get enrolled. And then, thank God we got enrolled. He said it's so popular that 1,800 position get filled within half hour.
Wow.
That's what they to be really patient and be very,
wow.
proactive.
Thank goodness to Magda, your wife.
Yes.
I had the pleasure of meeting her in San Diego.
Yeah, for many things. And she's the support. Before Joe Dispenza with the cancer, she's, my most important support, and my daughter as well. But you need to have a team. Your family need to be positive, encourage you. Sometimes when I see a patient, I see you that is really sick, but I know that in part from Joe Dispenza, but from other way of seeing life, the universal consciousness is around us. So it's using us as an instrument. If they comatose, intubated with sedative, it could be on the verge of being brain dead. So the family, I say, I don't take I'm realistic. I tell what the essence in medicine it is, but also being hopeful. Those patients, I tell, I want the family to come to touch the patient, not being there. Oh my God, just touch them. It's important to touch. Oh, that's one thing. But the other thing, I tell patients, family, I don't want no one negative here. Oh, if someone needs to see him, it would be to tell positive things and provide love, and support. Wow. Oh my God, for you, oh my, I don't want that type of thing. That drama, that doesn't add nothing. Those are negative. Takes away positive vibration from people. I want people positive. When I tell patients, family, but prognosis, I make them come out of the room, and I said, this is what's going on. Again, I'm being realistic. I need to provide the from medical standpoint, the evidence that it is there, even though I know that the person is aware when I'm talking. Oh. The essence, the energy is and that's different. I believe it by faith, because everyone think, oh, if the brain doesn't work, you will not get information. No, you get it from the source, from the what they call the universal intelligence. So everything that's surrounding is the real life, that uses you as a vessel, as an instrument. Yeah. So in any case, I am positive for, I advocate people to be positive, and people, that's what people need. If you're not going to help anything, don't come. Just prayer outside, but don't come here to sabotage whatever we're doing here to help. Oh, wow. And that include doctors as well. Some doctor, the people are hopeful, and doctor came here and told me this very, everyone is different. Mm-hmm. Everything happened for a reason. That this is our opportunity for the patient to do their part and for the family to do their part. Mm-hmm. So it's That's it, that everything happened for a reason, and that's the we look forward the positive avenue, positive way.
Can I ask you about the touching? Why is it important for them to touch your
Yeah, it's like babies. If you have a baby and they have like newborn, and you don't touch it, you're devoiding. It's a sense, but also is the vibration. Some people can perceive. I touch people. In a place that is neutral, not to be malinterpreted. So it is important to engage that type of thing. And some people are distant, or some patients said, and some patients said, that doctor did not touch me in the office. He just looked at me, was on the computer looking. He was looking at the screen, didn't look at me at all.
Yeah.
And nothing about in my opinion,
Yes.
From the medical practice, it's so automatic, everything, and had to be quick,
Yeah.
No, you have to look, look at the person in their eyes and know how they feel, and
No,
sense how they are.
The care and yes, I see. And we were talking about then your journey when your wife was with you as part of the team, and then she introduced you to go to the retreat.
Right.
Yes. But at that point, you had already years of your journey with myeloma cancer, right?
Right. Yes, at least 5.5 years. Yes.
And you had can you tell us about that prior time of your journey?
Well, I was, relatively very healthy, but then, for my immune system being compromised, maybe because of the stress. I think that has to do, and the stress is real. People, it's not like being weak. Stress is real, can decrease your immune system. And when your immune system is bad, you get prone to infection, and you're prone to, malignancy as well. So not able to recuperate. But the thing, it was after the Hurricane Maria. I was in Puerto Rico, and I noticed that they didn't have electricity, no lights, so it wasn't that good. I noticed that my skin had some infection, and I said, "Well, how weird! My body is usually good combating this type of infection." Then because job was here, the work was not good in Puerto Rico because of it took maybe 6 months to get better, to recover. Then I went to Florida to work as a neuro hospitalist in Ocala. So I went there, but then maybe I didn't notice, maybe a little bit less of energy. But I said, well, I'm stressed out. So essentially what happened is that eventually I lifted the gate and I had a very bad pain in my back. So I thought, with neurology, the pain management, I think, oh, this is a facet joint, a thoracic spine, something more mechanical, but it hurt me so much. And I have a high tolerance for pain. And then eventually I got an MRI. And then when I had that MRI, before the radiology, I was able to see the images from the screen. And I looked at the spine, and you see in that sequence of MRI, I see that dark vertebrae. All the other vertebrae were bright, and because the fat content in that sequence. But then that was dark, and I knew that was cancer. I have diagnosed cancer in other patients with the same findings. So, okay, I know why they have the pain. It's because of have cancer. And that. So is it from the lung? So I try to look a little bit if I can see part of the lung, maybe some finding, or it could be prostate. I was 55 at that time. Some people get prostate cancer, it goes to the bone. I thought maybe multiple myeloma. So I ordered the blood test, and they came back, and eventually the oncologist said, "Oh, you're right. So you made the diagnosis. You have multiple myeloma.
Oh my
So
goodness.
we need, chemotherapy. They did the bone marrow to confirm what they did. The bone marrow biopsy was 40% of my bone marrow was cancer.
Wow.
So be a lay person, it could be a physician. If you see 40% of your bone marrow being cancer, you say, well, doesn't look very good. So, and
that must have been just so shocking. Like, is it like for you to that knows and for you to find that for yourself and to like diagnose yourself?
Yeah, there's something I don't. It's like it's interesting, but the fact that you know what's going on, even there's something bad, for me, it's good to know.
Okay, it's
Some
like
people don't want. Some people, I know, I don't want to know what's going on with. No. I need to. It's good to know because then we need to react. What is going to happen is going to happen no matter what. So it's better to have the knowledge. With that, I want to include when I see patients with a stroke with some other condition, I show them the images of their brain. This is your brain. This is from the bottom all the way up. These are the eyes, the temporal lobe. They look good. These white dots are tiny stroke, and this bright spot is the stroke that you just had now. So if you know, I'm telling you, you should not be smoking. The blood pressure needs to be controlled. The blood sugar. So essentially, knowing is powerful.
Got it. Yeah.
And then knowing. And knowing with faith is even more powerful.
I love that.
Knowing being fatalistic, I don't think that's very good.
Got it. Okay. Yeah. That totally makes sense.
Yes.
You already had faith too. Like, I mean, you had, the power of knowledge, and you are a man of faith, right? From
Yes. Before, I go to church, the Catholic, faith. Yes. And but interesting enough, it's very interesting. I need to include this now. So when you're in the religious practice, you always hope for a miracle. You pray to this person, to this saint, he's going to be saying this person. And when I was healed with blood tests, healed with the bone marrow that came back zero, nothing, absolutely nothing. It was maybe 3 weeks after the coherent healing. So it's not imaginary, just objective finding.
Yes.
Medical. So the thing is that I forgot what I'm going to tell, but let me rephrase.
It's about faith.
So essentially, what I was looking for is someone to heal me.
God.
I'm passive. God healed me. I'm being passive. I have this saying just to help me, tomorrow to get healed. It doesn't work like that.
Okay, that's an important.
It doesn't work like that. So the thing that it could be controversial in a way, explain that I can smooth it out, is that I got healed not through religion. It is through God, through the source, but I didn't get healed directly through the Catholic Church or any other discipline. It could be Buddhism, something else. I got healed by what Dr. Joe Dispenzas offered from his heart to all of us. Yeah, I'm not just advertising him, but I think, well, if he were in a religion, he would be named a saint because so many people getting so much healing have an effect upon disease, upon people, but he's not in the religious realm directly. What we are learning and we are experiencing, we're not preaching, but we are sharing with all of you.
Yes.
So essentially that I got cured not through the saint itself, it is through God. No question about that. It was through God.
Yes.
In a certain way, certain avenue, in a certain space and time or belief but it was but it worked for me.
Right. Like the process like that he puts together and with the knowledge and it works. I mean, obviously,
and it worked for some other people. So I'm not the thing is that when the documentary came, that people, nice to meet you, and I said it could have happened to any of us.
Right.
Yes. It happened. They chose me to share my story, but it could be anyone.
Right. And that's
Many people have dramatic effect, but they chose me to become a physician because of my experience, and it can put into another perspective.
Yes.
But the universal can happen and happens to everyone.
Yeah, and that is also the purpose of this interview, is that to give hope and to for everyone to know that it is possible, like it is possible to heal. And
yeah.
There are maybe some misconceptions, some things that we may be missing, that you're helping fill out in these gaps of belief, of faith, of the placebo, of also knowing your own power, and then allowing all these things that that are really important, and that I really want to hear the rest of the story about the allowing part. I think that's a big piece that has been missing as well, of receiving, because you had to
yes
receive. And I know Dr. Joe says that a lot, and I think that we might not know, what does that mean? Like, how do I do it? Yeah, it's like, and from the questions and the themes of people, like there's a lot of like the doubt, and also the emotions that come with, like this, why me? This is unfair. How long is this gonna take? How much do I, just like these feelings that then sabotage the
right, absolutely, yes.
yes.
No, that's very unfortunate because some people, my patients, that the one that they don't do well, they're sour, they just upset, that they just doesn't have any faith, they try to blame someone else.
Yeah.
And then it's not that you have to look into the mirror, that it's you really. The circumstances occur and everything happened for a reason. But ultimately, once you are connected with the source, the things with you and the source. It's not you and the other people.
Ooh, that's
you realize you can isolate that, not isolate, but realize or visualize that thing doesn't bother you.
wow.
You're here, or just something that bothers you. But but once you are connected to the source, and the healing occurs there, doesn't occur in function of other people's opinion.
Wow. So how do we get to that point? And how,
Well, okay.
Yeah, how do we connect to the source? And I just thought of this question that came up before, and that is, in these questions, that so many people say, how long? Like, I meditate for so long, and not, and you told me something in the Spanish interviews. You said,
Right.
you can connect for, once you're connected, 1 second can become an eternity, like, because then nothing else matters. When you're connected, when you're there.
Yeah. Yes. And then people ask my wife, after the source document, okay, for how long do you see still?
Oh yeah, something. Yeah, just
okay. So essentially, they asked her for how long he's been meditating, and she said he doesn't meditate. He just have that week. It's not like years of practice. So when it happens, it happens.
Yeah.
Really, it's just like that. And then the most important thing is you have to, and I will tell you, the part of the story, you have to open up your heart.
Oh.
You can healing, flowing, floating in front, above, on the side of you. But if you don't open up your heart, it will not get in. You have to accept. Not only be humble, you have to accept.
Okay.
The moment.
How do we do?
For the second healing.
Oh yeah. Okay.
First, when I arrived, I actually arrived a day late because there was the flight was canceled. So anyhow, but I was able to go on the second, third day. Looking at what I knew, but looking at the screen, I was far away. I look at the blue colors of the screen, of the flower, everything, and how come I'm seeing this blue color so bright, like a blue turquoise everywhere? It's like having a filter. being outlined. So I said, well, that's
Wh-
interesting. It
Where were
must be
you,
a
where were you at that point when you saw the
I-
blue?
my second, on my second day, third day of the seminar of the retreat. It was not even the coherent healing yet.
Okay.
So, and I'm thinking, the Joe Dispenza is talking, and you are thinking, in your mind, absorbing and deciphering what's going on. And then I look this blue color out of the blue, in a sense. I see this blue colors. I say, why I'm seeing this blue color this bright? It calls my attention. So, and then I had like a revelation. I said, open up my mind, said, okay, you're cured at the genetic level of the multiple myeloma. And I felt something on the left side of my spine,
Wow.
like some pressure, some sensation. That was interesting because Bruce Lipton, another person, very wise person, said that you can control, their genetic expression, by being this realm of thinking by good vibration, or the essence. Anyhow, so that happened. So I went then at the last 3 days of the week long. The last 3 days are the one that you go as a Healy. And then I was selected as a Healy. I didn't know because I arrived late, and my badge has like a golden heart. I didn't know. As people, they're so busy. I said, "What does this mean?" They look, oh, come during the break. I went during the break, and they were so busy. I'll come later. I said, okay, no, you can speak to the nurse, and she told me, okay, you've been chosen as a Healy.
Okay.
So because in the information that we provide, was that I have multiple myeloma, blah blah blah. I said, well, okay, that's neat, that's good. Any help, I wouldn't mind, of course. The first healing, I went there with no expectation. I simply was there, a little bit nervous, I went in. I was laying on the floor. There were 4 people on both sides, Actually, not that they had not got in. I was on the floor like 200 other people, and I felt something touching my knees, my legs, and I said, "Wow, that's suggestion. That's my imagination. There's no one here, so I'm not going to bother with that." Then I had the healing. The thing during that healing session, I was not prepared to receive. I'm a physician. I give to everyone. So I said, well, these people are so nice. I'm going to give, from myself, give more vibration.
You're still receiving.
Yeah, spread everyone, the little bit that I have, was maybe more, but spreading it out. So that session of finish, I didn't see anything. I didn't feel anything else. I said, well, okay, that's neat. Thank you. So, and then I went with my wife walking at night to the hotel, to the room hotel, hotel of the room of the hotel that I was staying.
Yes.
Then at night, I had to go sleep early, maybe 8:30, because you have to wake up at 6 o'clock. You're starting the meditation, so I have to have I like to have some nice sleep.
Yeah.
When I turned the light off before getting into sleep, so I open up, my eyes are open, and everything was pitch black, and I see this blue color, like a fog surrounding everything. It was not bright. It's simply like a pale fog. And I put my hands to see if I can see. I couldn't see my hands. It was really pitch black. I look around. Maybe there's some blue color thing, light that is reflecting. There was nothing. And I told my wife, I see this thing blue, and then I see it too. So she will see it, and then the same thing as I saw. It lasted a few minutes, went away. In the morning, I woke up. I clearly heard in my ear a male voice, like through a synthesizer, saying hello. So, well, okay, I said, well, that's interesting. What people tell me, that people hear voices. Okay, that's a given. That's good. Okay, good. Okay, I'll take it. Okay, that's good. So for the second healing, I went there, the same, the first one didn't not much happen except, during the night. And then during the second, when I was in line for maybe 15 people, there were people enter through different doors, group of 15 to fill the 200 spaces. When I was there, I was a little bit nervous, what to expect, what's going to happen. And then the person who is directing every one of us inside was telling to everyone, face, to their eyes, remember that you're worthy. Remember that you're worthy. Remember that you're worthy. Whatever they offer you, receive. Don't contest. You're here to receive. Just receive it. Open up your heart and receive it. And then I said, when I was then walking, I said, something, I'm going to receive. Okay, I'm going to open up my heart. Whatever comes, welcome. Okay, I'm not going to resist. I'm going to surrender. I'm going to receive whatever they're going to offer me. And then I continue a little bit nervous again. I lay on the floor. And then when there were, during the early coherent healing, that people were extending their hands over me, first I saw a little, like a tiny, it's like a coin. It was not the size of a coin, like a little girl, maybe 8, 9 years old, like dark hair, dark eyes. And then last a few seconds. Like I said, oh, but that's interesting. This thing, the coherent healing, is bringing me hallucination. That's so neat. People use like mushroom to see hallucination. I don't have any mushroom in my system. It's something that's another thing. I haven't used that, but anyhow, that's a potential for therapeutic. Anyhow, and then I saw that disappear. Then I saw a Native American face, Indian. The same thing, a little like a coin, like that size, black and white, both. And it lasted a few seconds as well. Okay, that's good. I'm laying on the floor. They're doing the meditation, the binaural, music, people extending their hand. And then I suddenly saw a bright light I had my eyes closed, but I saw a bright light shining onto my eyes. And then one of the other, I think gave, the other person who is in the documentary described it was an annoying, and I could not describe it better. It was an annoying light, like shining on my eye, in my eyes. So, and I opened up my eyes to see if there's any blood light, if there's anyone shining. There was nothing. It was really kind of dark, very dim light. And then I closed my eyes again. And then again, I saw that bright light. I was not in a specific trance. There was nothing specific like seeing, God or anything like that. I simply saw that. And then I felt out of nowhere, simply without expecting, this sensation of unconditional love filling up my chest.
Wow.
There was, it made me tear, and it was a beautiful experience. I said to my, thinking, oh, this is, maybe this is what people describe when they die. Some people, they have this unconditional love, and then no prejudice, simply just unconditional love. It was, unique. Wow. I never. Then eventually everyone, the meditation finished, the coherent healing finished. And then, after finishing, I was telling everyone, I'm a physician. At that time, I have cancer, multiple myeloma, and I had this experience, and people were very emotional with my testimony there because they must have felt something. Then the same thing I'm going to do now that I did in the documentary. Then someone was there, said, I have this for you, and it was meant to be given to you, which is this card that has, say like heal. And I carry it with me all the time.
Was she one of the volunteers?
Of the healers, and I found out that was everyone's really special. So to have that, everyone, even the 3 sessions, because they open up their heart as well to help me.
Mhm.
It's not crossing my, it would just bounce. No. They have to open their heart as well to allow the energy, the love to flow and reach me. The only thing it was like amplified with
Right.
coherent, the coherence and coherent environment. It was such that it's easier to heal someone in those circumstances. On the third session, I felt healed already. So I felt, what can I ask? I saw the blue light. I felt that sensation, revelation, being healed at the genetic level. So, I had this unconditional love feeling of my chest that I didn't expect. What else can I expect? So I was grateful. That's
Uh-huh.
important. Grateful. I'm going to give away now. I'm able to give away my vibration expanding and try to move around, swirling around the energy. That some of the person after finishing, do you feel something? Or was something moving around, some energy moving and
Mm,
contact.
yeah.
Then I was walking in the air, in sense. It's just this exhilaration, sensation, love, joy, bliss. And then 2 weeks later, I had my blood test. Always nervous for 5 years, every 3 months having the blood test, always positive, always a protein M and the protein electrophoresis. Analysis of the protein in the blood that showed that I had multiple myeloma. The test came, I was the first one to see it. And then when I look at that, I said, there's nothing here. It was the same lab. I usually say, have monoclonal gammopathy, blah, 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 an explanation. Nothing was totally normal. And I looked 3 times, wow, there's nothing here. Well, something happened.
Yes.
And it was not the chemotherapy because until maybe a few weeks, I was still on chemotherapy. And there was some decrease in the level with the chemotherapy, with some functional mushroom, not magic mushroom, some like shiitake, like agaricus. There's some type of mushroom that have some adaptogenic capability, characteristic, and everything that I was doing, So then I went to the oncologist. He said, "Well, there's nothing here. Yeah, I wouldn't give you chemotherapy." And as I mentioned, this is a guy who was trained at Johns Hopkins. He's an empiric, scientific, academic oncologist who trains people and he's the one person that has been changed his paradigm, not change the paradigm, the view of the something real different that allows you to expand and get in healing realm. So and then I said, well, let's do the bone marrow biopsy. It's not fun. It's putting a big needle into the iliac crest, close to the hip. So anyhow, I have high tolerance for pain. I don't mind anyway. Not that forward, but that's okay. So he said, no, the test is negative. I said, no, I want you to do it because I want to show that this works.
Okay. Yeah. You wanted the evidence, like all
Yeah.
the.
Yes, and then he came and he said, okay, come next week or 2 weeks. I had the bone marrow biopsy, the same thing I have had the previous maybe 5 before. So, and then I went back to Yuma. I was in Puerto Rico, so I went back to Yuma to work as a neurohospitalist, and I'm there. So 3-hour difference. Anyhow, he called me. The phone number. So once you get the cell phone, a number from someone, you get nervous. Anticipatory stress. What will happen. And oh, Charlie, I'm calling you because we had back the result of the bone marrow biopsy. And okay, I want, there's nothing, absolutely nothing. It's completely normal, completely clear. There's nothing there. He said, I would expect he may have been practicing for at least 30 years. So I would expect to have some residual disease there. And there was nothing there. It's not imaginary. It's not like like imagining that hopeful thinking. No, negative. So empirically, scientifically, clinically, there was nothing. So So that was a proof that what did I do? I did the chemotherapy for some long time, didn't reach the point. There will always, it was maybe 5% at
Yes.
some. And when I was there, they decided to give me the 5th line of chemotherapy, was 6 months earlier, in which the bone marrow biopsy showed there was like 15 to 20% growth. Again, 20% before, after the bone marrow transplant, maybe 5-6%. And then eventually like 15 to 20%. And now, what was the difference? What was the variable? What was the essence that make, so it was the experience with the Joe Dispenza retreat and the coherent healing. And that's, it's important that this message goes to everyone that is looking here, because I was a skeptic as anyone else. You have to be certain degree of skepticism with what you have. But once you have the objective evidence, you say, okay, I can put this skepticism to one side and then look at the road of healing. And that's what it counts.
Yeah.
Doesn't.
And I bet so many people are asking themselves, how do I get myself into a retreat? What if I can't? Like, is it necessary, would you say, for people to go to a retreat to heal?
I don't think so, because there are other the healing at the distance, but it's a very personal experience, and it is easier in a way because the environment promotes, it's a holy place.
Yeah.
Once you put your feet in that place with so many people with good intention, with love, receiving and reflecting the light of the coherent love to a vibration, the vibratory state rises at that place. But some people can get that from other realms. The thing, some other people get the healing from religion. Yes, that can happen. It's the same route, it's the same source, it's God.
Yeah.
It's not just only through, it simply had happened or happened through Joe Dispenza retreat in my case, but it happened to some other people. I know other physicians who are diagnosed with some type of lymphoma, and physicians, home in the same position that they have been healed from their source through religion, and they're doing well. They're just no cancer.
Yeah.
But something is not absolutely necessary. It helps. If I want to advise, home advice from me, try to get like a coherent healing from a distance, or you have to be open up your heart. It will come anyway. So it will come to you. And it's meant to you. It's not if it were meant to me. No, it is meant to you. Open up your heart and it will reach you.
Yeah, like you said, you are worth it. You are.
Absolutely, you're worth to get healing, to get love.
Yeah.
You're worth it. So, and then once that happens, every doubt of what this person did this to me, what I experienced as a child, or this person didn't do what they have to do, and they end up having this accident. That with love and with gratitude, there's no space for doubt.
Nothing.
Once you have the healing and you're grateful, it's even more powerful, because it just excludes any negative thoughts, any negative influence that you can have, because you're filled with, you're blessed with love, with energy. So, and you heal.
Yeah.
So in medicine, the other thing that I have, like energy medicine, have been advocated. Yes, it has, and it has to do some common grounds, with the opening up, having faith, but just allowing to be healed. One important thing is that you decide to accept to be healed. So the problem with medicine this time is that I'm sick, I'm going to the doctor, and you're just like a lamb. You're just there waiting, what the doctor is going to do to you or going to give you.
Yeah.
If they do it with faith, yeah, I can help you, but you have, but the thing is that you have to have, there's some active component that you need to do to engage, to receive, and to get healed. You don't heal in a passive way. You
Wow.
heal in an active way.
Okay, that's so super. Like, I feel like that could be a clip, like a mini clip. You have to be active to heal. You can't be passive.
Absolutely, yes.
And that is you coming forth with belief, with being worthy, with acceptance, with openness, right? To receive, to that unconditional love. And it's you're mentioning so much love, and I feel like maybe that's an element that we probably think, yeah, it's nice, but when you actually feel it, like when it's actually like you're like inundated with it. In Spanish it comes inundado, when you're like when it flows.
Yes.
It's the most beautiful feeling. I mean, and you felt it, you received when you were in that coherence healing, and I think that can happen, not necessarily, like you said, in a retreat, it comes through our actively being open and willing. And so I think there's it's important to mention that, like, and we hear it so much, like love heals, but we can actually receive it.
It really feels when you accept it.
Accept it.
Because you can receive, not you receive, they can offer all the love in the universe, but if you don't accept, and accepting is the active part. You have to open up. No one can open up your heart for you. Okay, receive now. It doesn't work like that. You have to volitionally, on your own, have the faith. Thank you, I'm going to receive. So I'll allow it, the energy, the love from the higher realm, from the quantum field, whatever you want to, from God.
Yeah.
However you want to explain that, just active part, open up your heart, receive, and then it will flow. It will make you difference.
You were saying something, to bring it to, like, okay, with people, like, maybe listening to this is going to make a shift in them, receiving the book. Like you were telling me about the person that you met in the parking lot, that you shared that your story, and that made something click in her, that she had said
yeah everything after the first, after the retreat, your senses are enhanced and you see things that you don't see, a relationship, and that's good, that you're open up your mind, your eyes. But then what happened to me is that I meditate. A few days ago I meditated, and part of the meditation was the preparation for the healers. It was like a 17-minute, like, that's the time that I had because I was on call. So, and this is another patient, but this patient came with a stroke, brainstem stroke. She didn't look like that, and she had a small stroke on the MRI at the cerebellum. But the thing is that day I prepared myself to heal someone else.
Wow.
And when I went to see the patient, had a CAT scan already in the morning because she had some headache. I went to see her first. She looked good, but she was dizzy, some dizzy that she didn't have before. It progressed to complete weakness on one side. And then as a physician, as a doctor, you feel that sense of not able to help immediately. I wanted to have the magic power just to help her, but she was getting worse. She had a graded occupying two other arteries, like posterior cerebral arteries, and then she was going to be in very bad shape. We did an emergency MRI. It did not complete the stroke, but it was on the verge on that pathway. To make a long story relatively short, thank God we were able to work, and it was a teamwork. It was a nurse, it was me, everyone, everyone helping the family, herself, because you have to allow people to help you.
Mm-hmm.
You say, yeah, go to hell, yeah, that doesn't work. You have to open up, be able to be humble. Okay, I'm sick, I need help, and it can happen to anyone. So eventually we were able to identify, and we had to send her some other place for what they call an embolectomy, just through the groin, go to the catheter, and have that neuroendovascular surgeon to retrieve that clot to prevent it from producing actual damage. But that day, I felt grateful. I felt not scared, but I felt, rats. I want her to get better. She's getting worse, and she got better, and she got worse again. Said, that makes you humble. I'm not the one directing this, so I'm trying to do whatever I have a hand. And we were fortunate to direct her to some place that we're able to help. This other lady that I saw yesterday, I was going to pay my parking ticket, and then I saw this lady coming out from the car, and she was walking unsteady. I didn't think much about what was going on, but I saw her. I said, "Well, do you need help?" Yes. I was going to grab her. No, just put my hand. I'm going to hold on to your hand, your arm. So I escorted her for paying the parking ticket. She had to go back, and then you want help? She accepted my help. She was not like saying I can do it. No, she said, okay, yeah, I need help just because this is an uneven surface. Yeah. And then an interaction that lasted less than 3 minutes. So she was walking, and she said, this multiple sclerosis, I just came from an infusion, and I said to her, but I am a neurologist.
It was a lucky day.
She was surprised that it was happening, the person helping her immediately. And then I said to her, I had multiple myeloma, a cancer, and I was healed through something called coherent healing through Joe Dispenzas. She was just getting into the car. She said, a friend of mine gave me a book about Joe Dispenzas.
Yeah.
Before that, I said, I was hopeful, you're going to get better. Don't worry, no matter what they say, yeah, the doctor are telling them I'm going to get any better. They just, discourage me. And they're very good caring doctors. They're very good, but they get immune. Anyhow. And then when she said, my friend gave me the book, I said, you have to go there. You have to, look into that, do everything. This is my phone number. You can call me. I can explain you in more detail what's going on, but there's always hopes. And she was happy.
Wow.
That she was able, to have that piece of hope from someone that she didn't know. Who would expect us to be in the tapestry of time and space to find these persons? And they call it serendipity. They call it like God sent them, and that you can do a program about that. People having these type of messages from out of the blue. But in that case, I felt happy that I was able to help. Why? Because I had experience in my own flesh how being sick feels. And being able to give testimony, if I got better, you can get. Of course, you can also get better. I'm not exclusive or nicer than anyone. It can happen to anyone. And I told her, the very few, you have to open up their heart and receive.
Wow.
Yeah. That was that interaction.
Yeah. And I love that we can take this to, to the viewers, is that there is something, everybody has a journey, and everyone is in a different stage of healing something. Like, we're all trying to heal, maybe it's not a health condition, maybe it's a emotional condition, maybe it's things, but the being open to receive, I think that's such a key, because you never know, like by being open, but doing the things that, and I'll ask you in a moment, like what would you recommend us do every day, from your perspective, but that being open to receive, then healing can come in so many multiple ways and shapes and forms. You don't even know what it can be. A word from somebody. It could be, finding the book. It could be listening to this interview. It could be having the opportunity to go to a Dr. Joe event. It could be you meeting people in your community that do gatherings for this type of work. I mean, it could be coming in all sorts of ways. Don't you think?
Absolutely, yes. It's everything. Everything starts, as I mentioned before. Everything happened for a reason. Everything has it. And usually is to get you better, make you wiser, make you stronger, and with that, you help other people that are in the same path.
Yeah.
That's the important thing. This sounds strange, but I saw once a young lady who attempted suicide. She survived. And I said to her, from I'm not sure what they asked me for as a neurologist to see her. Maybe it was closer to the psychiatrist we're going to see. But I clearly told her, thank God nothing happened to you. But maybe part of your mission in life is helping someone who has the same thought that you have had of hopelessness, because no one will understand that unless they have been exposed to that type of trauma or stress or circumstances. Oh, how come you're thinking about that? No, you have no freaking idea how the person feels. You respect that. There's a reason for everything. And then knowing from inside, how does it feel, give you power to help other people.
It makes me teary because I'm just share it very briefly, since we just talked about the blue light and having that faith. I was at a Dr. Joe event several years ago, and I went with the intention to heal emotionally, and I did. On day 4 in the pineal gland meditation, I saw everything. He's in a moment said, you will understand why you went through everything you went through in an instant, and you will thank it. You will know that you had to go through that, and that's exactly what happened. He's like, there's a door. And when I saw the door, just all these things appeared. I have to make a separate video on all the story, but it was the healing came instantly. And every time I remember that unconditional love, I can only feel love for something that before used to cause me so much pain and so much anger and so much like so much frustration. It's like, oh yes. But I now know that others can heal from that. I had to experience it for myself, and and I can relate. And I just wanted to say that what you're just saying makes so much sense. There's a reason why we live what we live, and we heal in the way we do. And I think that we're meant to empower each other, help each other, support each other. We're all in this together. We're all one at the end.
Yeah, when I used to tell people, about the cancer and myself, with me, I said, well, I'm thankful that I got cancer. That sounds strange, but I'm very thankful, because if that didn't happen, I would be dull and dumb.
Yeah.
A combination with that, because the cancer, you get the diagnosis, you go back 2 steps, and then you just say, okay, let's work with this. I don't know what's going to happen, but I want to work with this. So then you are stronger. I am a stronger person. I have a better view of, more realistic view about what is the reality of life, of love, of purpose. So Yeah. So everything happened for a reason. Yes.
And I love that, you know, that you were chosen. And I love that. I think that you will continue to share this really important perspective, because so many still put so much faith in a doctor, you know, and put all like, you know, like, ask your doctor. Like everyone says, like the doctor has all like, but your perspective now, I feel like, opens up and will continue to shift the way it's an empowering message, you know, and to hear it from you, it has to come from you, because you will be, you know, I think changing again the bringing the power back, you know, and to every individual in Spanish and in English and however, you know, languages it can be translated as well.
Yes.
Yeah. So to wrap up, I want to just I want to mention some of the people that ask questions, and as I go through, you know, and honor them. And I think, you know, we covered most of it. Leticia Piscano, Marvin Arts, Silvia Rodriguez, Karen Lasich, Kathleen Boo, Lisa Barrick, Terry Wilburn, Hilda Mendez, Mary Luciano, Camille Lamana, a lot of women as well, like last time.
About that, for women are more receptive, more open than we as men. But you know,
see you
have a and do you know, explore that, you know, some other way. More about like, yeah.
But your wife encouraged you to go, so like the women, you know, encourage other
influence. Yes.
Influence. Jennifer Hudson, Katie Brown, Susie Fleming, Martina Perez, Nicole Sanks, Yoshiko Sindar, Mary Luciano. And the types of the health issues, conditions that were, you know, some of that were mentioned: type 1 diabetes, myelofibrosis, trigeminal neuralgia,
yes,
spinal cord injuries, some of the things, and I wanted to mention them because this applies to everything. This approach, this way, it doesn't, I mean, every journey is different, but it's the mindset, it's the energy, it's the belief, so it doesn't matter what condition it is.
Absolutely.
Yeah.
I agree. We're, you know, the physical illness is just a physical thing. It's not the essence of your life. The essence of your life is more beautiful, powerful. So and that's, it has to happen. Some people get sick just to be able to direct themselves into that healing journey, and you know, journey, and happiness and love journey.
Just a few things that I just quickly want to mention before we bring this to a close. So people, can we have an influence? I think this was important because, you know, people from an old generation that don't have this belief, this mindset, can a family member that does believe, that sends love and you know, healing, can we change the circumstances of that person? Can we have, like, let's say, you know, I have an uncle or a you know, a relative that is very ill, but they don't believe, but we send healing to them or prayers to them.
Why not? I think the fact of you praying for someone else that even though they're not receptive, they don't understand, always help. I have faith that it worked like that. Even if that person doesn't accept that, every day would be like a new page, like a new book, like open book. that you know, with a pen for you, for the person to write. If they don't want to write, help, love, that's up to them. But you're opening up your, you know, the book to that person, generating that book of energy of love, and then by looking at that every day, or they're perceiving that every day, the miracle will occur. There may be a circumstances but if they follow the true path in life, what we were designed to, of course, they're going to change.
I love what you just said, that we were designed to. So we're all designed. We all have.
Truly, yeah. Yes.
Yeah. And the key is to, every day is an opportunity. Every day is a new day. It's like every day we're open to possibilities. To
Yes.
Okay, well, to end, is there something that you could recommend to mind? How do we maintain this mindset? Like, how do we stay without these doubts? You know, doubts can continue to creep in into like that inner voice that kind of like can talk us out of it. Like, how can we continue to have this faith and not go back to the old self? Could you give us like a model that we could follow?
I can answer that in one word.
Really?
Grateful. If you're grateful, no space for doubt or disease when you're, yeah. And I learned like a revelation. I was from New Mexico up to Arizona, you know, to Phoenix. It's
Yeah.
a long, you know, those roads are very long, kind of boring. You calculate, oh, that those mountains are maybe 10 miles, and you check, you know, you play game with that. I don't listen to music, so anyhow, in a long trip, the problem is that many things will creep into your mind with doubts. Yeah, and then, you know, I'm talking about my healing, and then, you know, the doubts are, what about if you have cancer again? And you're talking about that you don't have the cancer, but what about if the cancer comes back? And they make you tremble, like put you out of that. And I had like a revelation. I said, if you're grateful, there's no space for doubt. There's no space to be thinking. You are healed and you're grateful. That's so much powerful that will expand continuously. So it will be like a, you know, like a boat, dividing whatever water, you know, whatever you have, you're just flowing in the same. That gratitude, that powerful. That's the next step.
Wow.
Is, you know, again, you know, mundane way. So everything happened for a reason. It happened to me. I'm going to work with this, you know, and then you realize that there's help. There's this help. You open up your heart. You open up your heart. You receive. You're filling up your body, your soul with love, and then after that, you are grateful. You're that gratitude. Even pulls away any thought of you know, of doubt, of disease, going back.
That makes it, and that fills me up with chills too. But that, it makes sense. We hear it all over, you know, gratitude is the ultimate state of receivership. Gratitude, and it just, you just help reinforce that even more. You just find gratitude. That'll get rid of all the take care of, that'll let us.
Absolutely. No question about that.
Well, Dr. Charlie, muchas gracias. It's such an honor. Thank you so much.
My pleasure, you know. And then before Joe Dispenza, I didn't have the gesture of putting my heart, my hands over my chest. And now when I really mean it, or see someone, you know, doing this, it has so much meaning, it's so much powerful, you know, the love. So that's something that is like a new sign, or a sign at some time that I forgot with the world, but now it's I want to thank you, you know, your wisdom, your blessing, your everything that God allowed put through you to reach all of us in a different way. Thank you.
I receive, and I give it back, and it keeps on giving, and may it continue to expand, and may people share this through clicking share, and through their words, and whatever it is that that the divine God let them have in their mind, that they continue to spread this message, so that we all heal and love and unconditional love, and are in the state of gratitude. So
yeah, the attitude and the healing and the gratefulness reaches time dimension. So some people are healing even before going to Joe Dispenza. There's some people who have cancer who are, how come you're still alive? I'm thinking, not that I didn't mean it like that. It's because that coherence healing expand and it's you in the past, and that's carrying you to be able to reach this place, and then continue healing forward.
wow, it's magical. It's
Yes.
being open to the to this beautiful frequency. Well, again, thank you so much, Dr. Charlie, and
Thank you for very, very grateful for your opportunity. And to everyone. Yeah, thank you.
And hopefully the movie will be available so that people can watch it, and but again, to just so again, so grateful to you, and I hopefully we'll see each other soon, and do this again if possible.
Absolutely. My pleasure. My honor.
Okay.
Thank you.
Yes. Okay, bye for now.
Okay, bye-bye.